Hi everybody, this is Angel Gates for Downtown Eastside Fighting for Our Lives, which today we are. I wanted to talk to you today a little bit about COVID-19. COVID-19 is a new coronavirus similar to SARS. It attacks your respiratory system and it attacks it aggressively. This has become a pandemic, which means all the governments across the world are in agreement that this is potentially could cost a lot more lives than it already has across the world. So yeah, the people that are most susceptible to this being life-threatening are elderly people whose immune systems are already down, babies who haven't built one yet, people with compromised immune systems such as HIV, Hep C, liver and lung disease, and I'm sure there's a little bigger list, and cancer patients and such. So I'm not coming to you today as just a person, a concerned person in the world. I'm coming to you today as a concerned person who lives in the downtown east side, who has some respiratory troubles, and who is a drug user. We have to be extremely mindful, and who lives under the poverty line. We have to be extremely mindful and work harder and keeping each other safer and ultimately alive than any other class in our society. Because we take care of each other here. We always have. And we have to be vigilant and remind our peers to keep a safe distance from each other at all times. So don't hug or shake hands. Don't even fist pump. Stay out of bars and crowded places. If you think this is a conspiracy, it's not. This is very real. And it's here. I want to explain to you what you can do to contribute to slowing down and or stopping COVID-19. First of all, number one is wash your hands, and wash your hands consistently. You have to wash your hands for 20 minutes or 20 seconds each time, and then turn the faucet on and off with unused paper towel. If you can find hand sanitizer and you don't have a means to get to a sink, then use the stuff that's 60% alcohol, and you have to rub that in until it's dry, and by that time you should be safe. So get in all the little nooks and crannies, you know. 2, don't touch your face. This COVID-19 travels through droplets from your coughing and sneezing, and you may touch a surface that has somebody's COVID-19 on it. And it comes into your system through your eyes, ears, nose, and mouth. So you don't want to bring it up. It can't get in through your skin or your pores, but it goes into your nose, ears, eyes, and mouth. So you don't want to bring it to where it wants to be. Number 3, I know that this is going to be hard for all of us, but we must practice social distancing. This means staying home. If you use drugs, try to stock up as much as you can, and I know that's tough because we are not rich down here. Stay 3 feet away from everyone as much as you can. If you are homeless in a tent city, you are at the highest risk right now on our street. So you must do your part and do your best to practice social distancing. If you can find an indoor place, do so. If not, try to stay in your tent and talk to your doctor and local shelters to see what you can do to self-isolate. Not doing so may result in a massacre with a loss of life even worse than fentanyl. And we took care of ourselves we've been taking care of ourselves through this whole entire ordeal. This is all we needed was another thing to slap us in the face. But I lost a page, people, sorry. Myself, I personally don't want to lose any more friends. I've had enough now. And this is really, it's scary for me. I mean, don't panic. Don't go out and buy a whole bunch of, like, toilet paper and hand sanitizer and not leave enough for everybody else. You're not going to need that much. Hopefully if we can slow this down by taking it on to ourselves as a community and a society, we'll give our health professionals long enough to try to figure out how to stop this and get a vaccine for us all. Social distancing is going to be hard. I personally am having an extremely hard time doing it, but it's necessary. My hearts and my prayers are with us all. Please do your best to stay safe, and don't share cigarettes. Okay, I don't know if I said this already, but I'm going to say it again. Don't share cigarettes. Don't share pipes. Don't share needles. Certainly not needles. And don't share makeup, girls, because it's on there too. You got to be so careful. Any makeup you do use now, if you get sick, you're going to want to throw out. Keep your houses sanitized. Wear gloves. That's about all I can tell you right now. The government has closed the borders. They closed the casinos, the borders. I think there's something about closing restaurants and bars. Because you really want to stay out of public areas where you're especially indoors and gathering in a public space with a crowd of people. They're saying you should not gather in places with more than 15 people. I say you shouldn't gather in places with more than 2 or 3, and you should keep a safe distance so that you're not getting the germs on you. I think it took a long time for the government to come up with this, and I think it could have been done sooner, but I do realize they're doing their best. I hope that they're doing their best. Because this is not just affecting us, it's affecting them. And actually, it affected them first, because we're poor, we don't travel much. But we do know people who travel. So if you know somebody that has flown away in the last month or so, go self-isolate and let your healthcare professionals know. Just because you're homeless doesn't mean you don't know nobody, and just because I'm poor doesn't mean I don't know nobody, you know? I just had a friend that actually came back from what was to be my trip to Italy. Or not Italy, sorry, Mexico. I had Italy on my brain. And he seems to be fine still, but there's so many stories. So basically what I'm going to do is what you should do too, because I want to get my facts straight, is go to the BC health I can't remember what it's called, but it's an official site. Google it for the COVID-19 virus, and you should be able to figure out what's happening there. I haven't heard about what's happening in the downtown Eastside so far, except that they're going to be giving out supplements to some people who are afraid that they won't be able to buy food. And as you all know, we are a little bit harder to buy than most people, so I know that the money will come in handy, and hopefully it'll be enough to get us through this. Yeah, just do your best, man, because nobody's going to help us like we're going to help us. They've proven that during this opioid crisis. Our jails right now are overcrowded, and so there's probably going to be quite a few cases in there. So, yeah, we just got to stay vigilant. Support each other in not being together as much. I know that sounds so hard, and a lot of our support systems we rely on people for a lot of the things that we do, especially people with mental health issues like myself. We need those support systems, and so we're just going to have to do it over the phone unless it's medical, and then hopefully they give most people carryaways and stuff. Yeah, I totally promise you this is real. And you know us, we share cigarettes all the time, we share pipes all the time, and if one of us gets it, holy hell, society's going to get it. Because we're everywhere, and I feel for the homeless people, man. But if you go to your shelter, your local shelter, go and check things out there, see what they can suggest to you. It looks to me like they are really, like this, the public is really, ironically enough, finally deciding that they want to really help homeless people. So, and poor people, because we are going to be the cause of the spread if we don't take action for ourselves. And I'm sure we all know that. I don't kid myself. Yeah, it's not easy for me either. Anyways, people, I really just wanted to let you know that Downtown Eastside Fighting for Our Lives is with you, and I'm with you, and so stay safe, stay healthy, and stay the fuck home. Peace.